Thank you for participating in the Give Back a Smile program. We sincerely appreciate your willingness to set valuable time aside to volunteer for someone who has experienced abuse. My name is Lisa Fitch, and I'm the director of the AACD Charitable Foundation. We are here to support your volunteer experience and have tips for you and your team for working with Give Back a Smile patients, or actually any patients who have lived with trauma. The Give Back a Smile case manager, Laura Borst, and I both have credentials in social work. You may have already heard the term trauma-informed. Implementing a few practical trauma-informed strategies in your practice can profoundly improve patient outcomes as well as patient and volunteer experiences. According to the National Council for Behavioral Health, 70% of adults have experienced some form of trauma, like domestic violence, for instance. Although Give Back a Smile patients have been away from abusive situations for more than a year, the impacts of trauma are long-lasting. Trauma affects development, wellness, and stress responses across the lifespan. We are here to provide you with easy-to-carry-out tips to implement trauma-informed care within your practice. These techniques will not only be helpful for Give Back a Smile patients, but all the patients you care for. Now, let's start with preparation. Be sure your entire team is aware of your Give Back a Smile participation and that your services are being donated. Everyone should be aware of the patient's name and when they are scheduled. We've had GBAS patients be accidentally turned away because the rest of the team was not aware of the dentist's participation in the program. Assign a designated team member the role of greeting the patient. For the first appointment, consider scheduling an extended visit length and plan for a private place to meet with the patient. Now, the patient has been pre-screened for GBAS program eligibility. Your consultation appointment is to decide from a clinical standpoint whether you can provide the dental services the patient needs. It's very important to believe the patient. Be aware that inquiring about the patient's past trauma and abuse can actually be re-traumatizing. We provide you with a copy of the patient's reviewed application in advance, which describes the prior abusive situation so that the patient does not need to discuss this difficult topic during dental appointments. Now, let's talk about your office environment. Establish a sense of calm, welcome, trust, and safety for the patient. Consider having tissues around and be aware of chair positioning. Some people find comfort in being able to see the door or feel more comfortable with the chair in the corner. Laura Borst, who is the Give Back a Smile case manager, will now provide some tips for interacting with patients.
Hello, here are some tips for interacting with patients. People who have survived violence and trauma have likely experienced boundary violations and abuses of power. When greeting patients, staff should always communicate in a manner that makes patients feel they are equal to staff. For example, when interacting and the patient is seated, everyone should be seated to address a power imbalance. Create an atmosphere that allows patients to feel validated and affirmed with each contact. Be sure to have a conversation with patients rather than accomplishing a checklist in front of a computer. Patients need to feel they have control over their own lives and choices. For example, when assisting a patient to another location, ask them whether they would like to walk ahead of, behind, or beside the staff member. Be sure to explain all steps of the visit. Communicate clear and accurate expectations about services. There should be no surprises or blindsiding. Inform patients of every step in the initial intake and offer them a choice about whether to proceed with any steps that are optional. Laying in a dental chair innately creates an imbalance of power, which for some people could feel triggering. It's important to ask permission before all steps of any exam. Again, this creates a sense of safety for the patient. Ask about comfort. Set up signals for stopping and arrange nonverbal cues for discomfort. As we've mentioned, patients need to feel like they have control over their own health. Give patients a role in their treatment plan and services. For example, provide treatment plan options when feasible. If you can provide the dental care the patient needs, there are things you can do to help ensure the patient's return for the treatment. In the case that the patient has moved or has a new phone number, confirm their contact information at each appointment and let them know the phone number that will appear on their caller ID for your appointment reminder calls. Thank you again for taking the time to learn more about trauma-informed care. Please reach out to us if you have any questions, and if for some reason you cannot provide the services for the Give Back a Smile patient that has been referred to you, please contact us right away.
Thanks, Laura, and thank you for your care and generosity. If you have interest in learning even more about how to implement trauma-informed practices in your office, check out these additional resources.